We have M who's on here. Not sure if she wants me to say her full name, but she is looking for suggestions to help with burning and pain in her thighs and buttocks.
Oh, that's a difficult one.
I had a feeling.
So the question is why, right? So how old is she?
40s,
Guesstimate. I mean, we don't have to be accurate.
40s.
40s?
54.
Okay.
No, you're
So
not.
so
45.
so the question is why, right? So there could be so if you're, diabetic, if you're obese, you could have neuropathy just from diabetes, right? You could have, and again, I'm kind of going over the non-vascular causes first, right? So you have to figure out why. So is there like a lot of scoliosis? Is there a lumbar spine problem? Is there a radiculopathy? Is there like a nerve compression which is causing it? When is the burning happening? Is it all the time, or is it with ambulation? Is it more towards the end of the day? Is it sort of generalized in the entire leg, or is it just in one particular area of the leg? So this has to be obviously, examined and then talked about in more details. But if you do have risk factors for peripheral vascular disease, now I'm using it like a global term, so then I think you should basically start with getting a routine like ankle brachial index with and without exercise to see if you have, arterial disease. If you notice that your legs are more swollen towards the end of the day, you have, a lot of superficial veins, you have maybe varicose veins or spider veins on the legs, and you have a lot of cramping, then you could, get evaluated for venous insufficiency. But just burning and tingling sensation, that could be any number of things.
And that is even if you do have P.A.D, we have all kinds of things that could end up, causing some of those. But she says she knows it's actually from the P.A.D. But any suggestions potentially to relieve some of those symptoms? She's trying to delay having a procedure. She's trying to walk and push things a little bit further each and every day.
I think so if it is just the neuropathy where you have a lot of burning sensation, obviously if you're diabetic, you want to make sure that your A1C is less than 6.5. So that is very, very important. But then there are medications like gabapentin or pregabalin, which can help with neuropathy. Problem with these drugs is that, they do make you very dizzy, very sleepy. So some people don't tolerate it. And then some people sort of develop resistance, so to speak. So you have to up titrate the dose. Then there are certain antidepressants which can be used, like amitriptyline or duloxetine, which can help. A little bit of massage, like Epsom salt baths, things like that will give you sort of temporary relief. Unfortunately, there are not too many medications who truly help, like eradicate the underlying problem. They may help you symptomatically. Sometimes, getting tested for like vitamin B12 deficiency. So if you have that, fixing that will help. Taking magnesium supplements may help. And if you truly have P.A.D, then I've seen a very good response with cilostazol, Pletol. So if you're not on Pletol, then maybe getting on low dose of Pletol, 50 milligrams twice a day, and then increasing it to 100, that will help. If you have a lot of restless leg type syndrome where you feel like you have to cut your legs and hang them on the wire, you have to get up at night because your legs just cramp up and you have to get up and walk to feel better. That's called restless leg syndrome. So if you have that, then you should get tested for sleep apnea, because there is a direct correlation between that. And then you can also ask your doctor to get on a medication called Requip or roperanolol. which is excellent medication for RLS. So, it's sort of hit and trial, what works for individual patient.